Peace be to you all. This is Omar, Abdul-Malik, physician assistant and health educator. I wanted to talk to you all about breast cancer, which may seem like an odd topic for a man to speak about. I'm a clinician and health educator by training, so anything dealing with health and or education, I think it's my responsibility to at least make some kind of public announcement about that. As a hospitalist, physician assistant, I treat a number of women who have breast cancer, and unfortunately, in many cases, it's metastatic breast cancer. Even after the woman has had a double mastectomy and chemotherapy and radiation therapy, it's already metastasized to different parts of the brain or the body. This has happened to family members of mine, and it's really a tragic way to go. It's a long, protracted death. I've become somewhat passionate about making sure that people get at least checked for breast cancer early. Now there's controversy. There's different schools of thought, as there is with everything. Some schools of thought are saying that, well, you don't have to get checked, until you're older. Studies have shown that it doesn't really matter. I think if you fit a certain demographic, a certain racial demographic, so if you're African American, and certainly if you have a history of breast cancer in your family, and you're over the age of 40, and you have modifiable risk factors like smoking or living in or near a heavily polluted city that has a lot of air pollution, that can also be a link as well. And then if you have things like obesity also, and I've heard about things like fat shaming. This is not fat shaming. This is talking about science and math. If you have a BMI of over 30, so your height to body weight measurement and your percentage of fat, that is a risk factor for various types of cancers, breast cancer being one of them. And that often goes with, I believe that often goes with lifestyle. There's lifestyle modifications. I'm at higher risk for breast cancer than most men, just because it runs in my family. There's a genetic factor there. When I was doing my medical training, in particular surgery, I helped perform lumpectomies and biopsies on the areola of men who had galactorrhea, so milk coming from the nipples, also blood coming out of blood discharge from the male nipple. That's a sign or symptom of possible breast cancer. So you have to get that checked out as well. It's nothing. With a lot of the medical modalities that we have in this day and age, nobody should have to die from it. I don't think. It's just my professional and personal opinion. If you catch it early enough, I know people who are in remission for breast cancer. They've been in remission for years and years, which is really good. My own mother had a scare with it. But I hope that those of you all that hear this or watch this, do get yourselves checked out at regular intervals. There's a lot of good websites. CDC's got good websites that will show you when and how to get checked. Here in Washington, D.C., we have something called there's a breast mammogram mobile. So it actually will come to different areas of the city and give women free breast exams. It's not very comfortable from what I've seen and what I've heard. They've got to mash your breast in between this. It's a scanner, but it's important. You know, it's better to get it caught early. I should say that most masses that women incidentally find are not cancerous. So I don't want you to panic. I've had women coming to me like panicking. I found a breast mass. Do you have cancer? It's like, no, you need to get some scans, get a mammogram, and then get it biopsied first before you panic. But that's an important caveat. So that's all I have to say about that for now. Please consider subscribing to my channel if you have an interest in various topics in healthcare and education, in particular physician assistant and health education. Or if you just want to live a positive lifestyle. I wish you guys the best of success in your positive endeavors. Be an advocate for health and education for yourself, your family, and your communities. Peace.